The iLA membrane ventilator is an extrapulmonary ventilator that breathes for the patient outside of the body and thus focuses on protecting the lung. It serves to remove carbon dioxide and is perfused with blood by the heart, just like a natural organ. Gas exchange takes place via a plasma-tight heparin-coated diffusion membrane, which is connected arteriovenously to two Novaport 1 femoral cannulas. The following video presents step-by-step directions for initiating clinical therapy with the iLA membrane ventilator. These directions are intended as an additional aid and cannot replace on-site training by Novalung's clinical specialists or training at the Novalung Academy. After all necessary patient exams and preparations have been completed, lay out the required materials and ensure that nothing is missing. The iLA membrane ventilator, the appropriate patient-specific cannulas, sterile drapes and gowns, and a basic sterile dressing pack, masks, caps, and sterile gloves for 2 people, skin disinfectant, 500 milliliters sterile crystalloid solution, a gravity infusion set still sealed, 100 milliliters heparinized saline solution with mini spike, 2,000 units in 100 milliliters, 3 20 milliliter syringes, a set of sterile compresses, surgical suture for cannula fixation, various bandages to hold and fix the tubing, and to cover the venipuncture sites. After opening the sterile packaging, remove the upper tray with the sweep gas tubing and hand the tray to your assistant. There is a sterile drape in the box. Use it to cover your working surface. The box also contains the holder for the membrane ventilator, a bag with various accessories, the priming line, and the iLA membrane ventilator. Place the membrane ventilator in the holder. The female safety connectors are on the end of the tubing on the iLA membrane ventilator. They consist of either a red or blue locking ring and a release device. Depressing the release device opens the locking ring and the transport protector cap can be removed. Follow the same procedure on the other side. The protector caps on the priming line can be removed simply by pulling them off. There is a soft sealing ring on the end of the male connector. Behind the ring, there are 2 grooves into which the locking ring of the female connector can slide. When connecting the 2 ends, make sure that the soft sealing ring at the tip is not deformed in the process. We strongly recommend wetting the seal with sterile saline solution first to make the connection process go more smoothly. Press the connectors together carefully in a straight line while rotating them gently until the locking ring slides into the groove and you hear a click. Never use force to make the connection. If making the connection seems to be difficult, open the locking ring and try again. Remove the yellow caps from the de-airing ports. Connect the infusion line with the crystalloid solution to the central port of the priming line. Open the infusion line and raise the membrane so that the fluid rises evenly in the tubing without any air bubbles. When the fluid level is visible in the membrane housing, you can place the iLA membrane ventilator back in its holder. Ensure that the CRRT connector caps are properly tightened. To do so, simply pull off the white safety clips, tighten the caps, then replace the safety clips. During the priming process, do not exert any pressure on the infusion bottle. Exerting pressure could cause air bubbles to be trapped in the membrane, which would cause problems later on during the treatment. When the membrane has been filled completely, the flow will decrease. By tapping on all 4 white gas covers, any remaining air can be completely eliminated. When no air can be seen and the fluid flow has stopped completely, you can place the iLA membrane ventilator back in its holder. The white safety clamps on the tubing should now be pushed up close to the connector and then closed completely. The iLA membrane ventilator is now ready to be connected. In preparation for insertion of the NovaPort 1 cannulas, the guide wires are first inserted to the femoral artery and femoral vein. Use ultrasound to locate the femoral artery bifurcation. Venipuncture should be made at approximately a 45-degree angle. Now insert the guide wire that is included with the NovaPort 1 cannula. The guide wire is forwarded to at least the 30 centimeter mark. Now insert the other guide wire in the remaining femoral vessel. Make an incision alongside the guide wire for insertion of the NovaPort 1 cannula. Slide the cannula over the guide wire. An assistant should hold the guide wire so that the NovaPort 1 cannula can be inserted over the wire without any resistance. This will minimize the chance of injuring the vessel wall. The insertion depth is indicated by a black mark on the NovaPort 1 cannula. Now pull the guide wire back a bit. Unlock the dilator by pressing the claws at the end of the dilator together. Hold the vent plug at the end of the NovaPort 1 cannula in place and pull the dilator back. When the third line on the dilator is visible, pull out the guide wire completely. Attach the 20 milliliter syringe that has been filled with heparinized saline solution. Rinse the blood out of the cannula and back into the vessel. During this process, the vent plug and the dilator must be held firmly to avoid blood loss. Clamp the cannula while the last few milliliters are flowing through the cannula. Remove the dilator and the vent plug completely. Before connecting the iLA membrane ventilator, the priming line must be removed. To do so, press the release device and pull the priming line back. Now take the iLA membrane ventilator, together with the holder, and place it between the patient's legs. Make sure the connections are correct. The red connector goes to the arterial cannula and the blue one to the venous cannula. When making the tubing connection, slide the connector only as far as the first locking position. When the connector slides into place, you will clearly hear a click. Now the connection cannot be pulled apart. De-air the intermediate space in the connector using the third syringe filled with heparinized saline solution and the blunt cannula included with the NovaPort 1 cannula. To do so, open the connector, insert the blunt cannula, and secure the cannula. After turning the connector so that it faces upwards, it can be de-aired. When the space is completely filled, the luer connector is closed again. Repeat this process with the other cannula. Release the safety clamps on the tubing of the iLA membrane ventilator and slide the connectors together until they lock into the second locking position. Make sure that the connection is firm. Repeat this with the other cannula. Now have someone place the sensor of the NovaFlow monitor on the tubing between the CRRT connector and the patient. Keep in mind that this area is no longer sterile. After turning the monitor on and completing the self-test, use the knob to select the numeric option in the lower display menu. Suppress the alarm by activating the speaker button. Then select the 0 button to set the 0 point and press the knob to confirm. The 0 point has been set successfully when 000 appears in the display. To release the blood flow, first completely remove the clamp from the venous NovaPort 1 cannula. Now, open the clamp on the arterial cannula slowly and continuously while observing the patient's hemodynamic situation and the blood flow. Allow at least 60 seconds for this process. During this process, keep in mind the reduction in cardiac afterload and the resulting hemodynamic changes. Move the cannula around gently to find the optimum position. To prevent dislocation of the cannula, suture the cannula in place and secure with adhesive tape. Suture the cannula to the skin between the white ring and the connector. After suturing the cannula in place, secure the cannula with an adhesive strip placed between the white ring of the connector and the insertion site. Use a sterile wound dressing, compresses, and adhesive gauze or transparent film to cover the insertion site. Keep in mind that the connectors must remain uncovered. Remove the sterile drape and continue securing the tubing by taping it to the thigh using generous amounts of adhesive tape, ideally in a total of 3 places. A few minutes after the blood flow has been released and the cannulas and tubing have been secured in place, you can replace the yellow caps on the de-airing ports of the iLA membrane ventilator. Connect the oxygen tubing to the flow meter on the wall outlet using the Christmas tree connector included in the iLA membrane ventilator. The short end is connected to the sweep gas port on the membrane. Treatment with the iLA membrane ventilator can now begin.